Good morning. My name is Caitlin Lowry. I'm a licensed marriage and family therapist, and my practice is called Tailwinds Therapy, located in Clovis, California. I'm jumping on here today to teach you a little bit about Equine Assisted Services. So one of the unique things about my therapy practice is that we offer traditional therapy services in office and online, but we also have people come out and work with horses as part of the therapy treatment. And that falls under a category known as Equine Assisted Services. Some people are really confused by this field in general, and so I want to jump on here and try to provide a little bit of education to help you understand a little bit more. So here we go. The field of Equine Assisted Services is incorporating horses into a service that's being provided. And so this can mean a lot of different things depending on the type of service that a practice is offering. And when we look at it, it can also get confusing because the language over the years has been very different depending on the different model individuals are trained under, or perhaps a business has just kind of gone with what's familiar and talked about their service in a way that other providers in the area have maybe described their services. But there's not an overarching entity that certifies or provides licensing for individuals who are offering equine assisted services. And because of that, the language got a little muddy over the years. So a lot of the different treatment programs are, or training programs are trying to get together and unify the language a little bit more. So they're trying to create an overarching term called Equine Assisted Services and have three main categories in there that explain the different types of services that are being offered. And from there, it's going to just be changing a little bit as things go. And we're all doing the best that we can. I'm not on here to say this is right, this is wrong. What I'm looking at is how do I best explain the work that we do and help you understand a little bit more so that if you are looking for something else, you can also find that as well. So as I mentioned, Equine Assisted Services is incorporating horses into a service that is being provided by the business or practice. And this can mean different things. So for example, I grew up and I started riding horses whenever I was about 5 years old. My parents found a horse trainer who was offering riding lessons, and I started with what's considered as traditional horsemanship. And when you start working with horses, you typically learn how to care for horses, grooming them, how to feed them, how to care for them in those ways. And then you also then begin to learn how to ride and practice like proper equitation and horse training. And that falls under that horsemanship category, but specifically traditional horsemanship, because nothing's being changed about the way the service is provided. When we look at Equine Assisted Services, the three main branches are horsemanship, Equine Assisted Learning, and therapy services. So I want to start off with the horsemanship piece, because when we're looking at Equine Assisted Services, the horsemanship has changed a little bit so that it is something that can be adapted to the needs of the individuals who are being served. So for example, if you have somebody who is coming in and they're getting Equine Assisted Services and the individuals in a wheelchair and they need their services adapted in a way that they can safely interact with and ride horses, that service provider is going to be offering something called adaptive riding or adaptive horsemanship. And typically in this, they are going to be changing the way that they have individuals work with the horses in a way that is going to meet their diverse needs and still provide a safe and supportive environment for them to have those interactions. This can be done by non-licensed professionals, such as like horse trainers or just experienced horse professionals. We often call them equine professionals or equine specialists. And they can sometimes incorporate different other providers that they partner with, but typically with the horsemanship piece, the main goal is teaching people how to work with horses, ride horses, and have that therapeutic interaction with horses where they're still getting emotional benefit from it, but it's not providing therapy. And so typically it falls under the category of adaptive riding. People may have adaptive horsemanship. It could be adaptive driving where the horses are pulling carts and the people are sitting in the cart being pulled by the horses, but it's adapted in a way to meet their diverse needs. And beyond that, these individuals may have specialized training through certain programs to provide that service. They also may not. The next category I want to jump into is equine assisted learning. So equine assisted learning is a activity that incorporates horses into the service that's being provided, but the main goal is an educational goal. So this could be provided again by someone who is licensed in a field or may not be. So for example, like a teacher, they typically have a teaching credential and they could incorporate horses into a treatment model that has a goal of equine assisted learning. And they have some really great programs out there. One in mind that kind of comes up is one that has students come out and work with horses, and it's a reading program. So the goal is educational. It's to improve the reading abilities for these students, but they're working with the horses as part of that. And in this field in general, people often have a team approach where they'll have a professional who is, part of their field. So like a teacher or a therapist, and then they'll partner with an equine professional so that that person is helping support that horse piece. Sometimes it overlaps where that individual is also, so like the teacher may also have horse experience and is doing both in one session. Most models that we get certified or trained in like the idea of having multiple people for each role. So you'd have like your teacher, your equine professional, and then the horses as that treatment approach, so that triad. When we look into the next category, therapy services, this one gets a little bit more specific. And the reason for that is to provide therapy services, the providers need to be licensed in the field that they are licensed in. So for example, I'm a marriage and family therapist. My license is through the Board of Behavioral Sciences. State of California determines that I am qualified and fit to provide therapy services based on my education, my training, my experience, and my continued education. And because of that, my scope of practice says I can provide psychotherapy services. It doesn't say anywhere in there that I have to have horses or can't work with horses or anything like that. So the scope of practice is what your license says you can do. Beyond that, there's something called a scope of competence. And when we look at scope of competence, that is what is your training skills and expertise based on, different areas that you've had trainings in. And so, for example, I have that 30 years of horse experience in combination with a license as a marriage and family therapist, but I also carry a certification as an Equine Assisted Growth and Learning Association provider, the GALA model, where people come out and they do a certification program for you to incorporate horses into psychotherapy treatment. I also have been working towards certification with Natural Lifemanship, where it's trauma-informed equine assisted services. So that increases the competency of the provider. And in the field of the therapy approaches, so equine assisted services, therapy practices, we ideally would use language like psychotherapy incorporating horses. People still say equine assisted psychotherapy. I know I do in my practice. But the reason why it gets a little bit confusing is some models will say equine facilitated psychotherapy, some say equine assisted psychotherapy, and they just wanted to make it get a little bit more clear as time goes on. So the therapy services are provided by a person licensed in a field. This doesn't mean it's just mental health though. When we look at physical therapists, speech language therapists, or speech language pathologists, and occupational therapists, they actually had a different field called hippotherapy, no hippos involved, where they were working with horses as part of that treatment, but it was specific for those three main categories. So speech language pathologists, physical therapists, and occupational therapists. And the kind of overarching attempts to try to unify the field or even trying to change the name so that that still would just fall under the category of therapy services within the field of equine assisted services. But the language is still used. And so, for a lot of us providers, we're trying to make it make sense to people. And when you look at things such as hippotherapy, where people are working with those three categories, these are licensed professionals partnering with horse professionals and incorporating horses into the therapy treatment to best serve their clientele. And again, it's something that is usually a little bit more specialized. The individual is not only licensed and trained in their field, but also typically carry an additional certification or training in doing the equine assisted work. So I hope that makes some sense to you as far as kind of the main branches under equine assisted services. And again, it's one of those things that's kind of still changing and growing because this field's really only been around for about 20 years. So when I was in grad school back in 2010, this was something that was still emerging. It was only about 10 years in at the time. And, you know, I know even for me, whenever I first started looking at it, I was going, well, wait, aren't people doing, and I was thinking more of like therapeutic riding or adaptive riding, where people were working with like children with autism and supporting them with doing mounted activities with the horses. And I didn't even realize that people were getting into the mental health side of things, where people are coming out and work with horses to help reduce things like anxiety and depression and help heal trauma. And I opened my practice in 2019 so that I could begin offering some more services in our community that help incorporate horses into the treatment, because it's really powerful work. And so our clients come out, currently we have a 12-week program called Take the Reins, where people come out and they work with a horse as part of their therapy treatment. And depending on their treatment goal, we go through the initial assessment, create a diagnosis and a treatment plan. But depending on their treatment goals, we have specific activities or interventions with the horses. And they will do things such as, you know, say we're working on teaching clients about healthy boundaries. We'll have them working with the horse and setting boundaries with the horse, or, you know, using obstacles in the pen to create a boundary and then ask the horse to come up to the boundary, communicate how to keep the horse out of the boundary, how to let the horse in. And it will mirror a lot of how they would interact in their human relationships as well. So there's a degree of learning that's going on there as well, but it is specific with the treatment plan in mind, and it's specific of targeting those therapy treatment goals. And I provide my services with an equine professional. I really do support that idea of, even though I have 30 years of horse experience, I want someone out there who is supporting the horses, watching the horses, helping make sure that our clients stay safe around the horses, and then I am able to focus a little bit more on the therapy side of things. And it works out pretty well. So if you want to learn more, go onto our website. It's www.tailwindstherapy.com. You can click the link in the bio and learn a little bit more. And our program is called Take the Reins. All right, thank you.